Good morning.
Good morning,
Jen.
Liz.
People often associate epilepsy with seizures, but there are other symptoms that we should know about.
There are, and I think what's really important is you might not always see those classic muscular spasms. So it is important to realize that there's a range of signs and symptoms. These are obviously very common with epilepsy, but people don't think of them as a form of seizure.
And what's the connection between seizures and hormonal changes?
Big connection, in fact. This is a perfect example of how we have a condition that can affect men and women. A third stay the same, roughly a third could get worse. And obviously, because it affects younger women, there are effects of women on birth control, hormonal contraceptions, and in pregnancy.
And for women like Anne who want to be a mom, what are some concerns about pregnancy with epilepsy?
Critically important for women of reproductive childbearing age to talk about the immediate radar. Very, very important.
Such good information, Dr. Jen, as always. Thanks so much. Coming up.
And a very good afternoon to you and welcome to What You Need to Know. We want to start with breaking news out of Baltimore. The collapse of the Francis Scott Key Bridge. Now the search, so that impact will be felt for weeks, even months to come. Ike, thanks again. All right, let's talk to you about a big medical topic here, rather. Measles cases here in the U.S. are up, and the numbers are higher than last year.
Yeah, so this is a major medical headline, you guys. We are tracking this ongoing measles outbreak in this country. Let me take you through the numbers. This is largely an unnecessary outbreak that we are tracking amongst unvaccinated individuals because the MMR vaccine with 2 doses, 97% effective. So again, awareness is important here.
Are there any long-term issues if you get measles?
You know, I think the 2 important things here is that most healthcare providers in this country, because this was eradicated 20 years ago or more, have never seen a case of active measles. Yeah, the answer to your question is there are long-term, potentially very serious consequences: blindness, deafness, pneumonia, encephalitis, in some cases death. So we need to take this seriously, and the education and awareness has to be there.
It's alarming, to say the least. All right, Doc, thank you very much. We appreciate it. Still ahead here on GMA3. We are back now with Dr. Jen talking about a new study that's taking a look at job flexibility and security associated with less anxiety and psychological distress. Break this down.
Oh, okay, right. You probably had your attention when I heard you say psychological distress. So this was a study done by the CDC of about 18,000 people survey and tracking their responses to questions about our psychosocial well-being, our mental health and wellness associated with employment. So I'm going to drop one of the questions on you guys. How often do you feel worried, nervous, or anxious?
I think before anything big, like a big interview or a big show or something like that, when there's something like major.
Okay.
I think it depends on the week.
Okay. Honest answers. Okay. But just hearing that question was enough to trigger anxiety in the response.
Just talking about anxiety.
That is correct. So what they found then is that when people had jobs with more flexibility, you know, another way of talking about it is the ability to have work-life balance, that their anxiety levels dropped. That's not really a surprise, right? When you talk about the stresses and people working just one job, let alone people working more than one job, and how they juxtapose their personal or out-of-work responsibilities, it's not a long reach to suggest that it can cause significant distress in terms of our psychological well-being. So talk to your employers. Employers, if you're watching, maybe a little more flexibility there will help lower anxiety, and guess what that's going to be good for? Literally everything.
Yeah, but what about high-pressure jobs?
Like sometimes there's nothing you can do about it.
I think that the type of work is different than the responses that you have in managing your life outside of work.
All right, we'll take it, Doc.
More flexibility.
Back in a moment, folks.
4-day work week?
All right, folks, welcome back to GMA3, What You Need to Know. We are tracking new developments out of Baltimore following that massive bridge collapse here. Let's go back to ABC's Ike Ajachi with the latest. Ike, for the latest.
Yeah, heroes for sure. Dr. Jen Ashton is here with us now answering one of your medical questions. Here it is. Can endometriosis be seen on imaging, and what type of tests are needed for a diagnosis?
So first of all, some mini GYN medical school, endometriosis affects 10 to 15%, possibly even more women of all ages. It is a chronic and often very debilitating condition that can be associated with pain, infertility, in some cases a slightly increased risk of ovarian cancer. Typically involves a significant delay in diagnosis because Classically, the diagnosis has to be made with surgery, where there's actually a biopsy of these lesions. The short answer to the question is, can it be seen on imaging? Sometimes with something called an endometrioma, which is a cyst involving the ovaries that are filled with these endometriotic implants, but not always. So there's exciting new research about working on using menstrual blood as a way to diagnose this condition, but we desperately need new diagnostic methods because so many women suffer with this.
Most certainly. Art, your prescription for wellness.
All right, in honor of Epilepsy Awareness Day, if you observe someone having a seizure, so often people don't know what to do, so some seizure first aid here. First, you want to ease that person gently onto the floor and turn them on their side. That's the safest position for them. Put something soft or flat under their head just so that they don't injure themselves in the course of the seizure. Do not, I repeat, do not put anything in their mouth. That used to be done in the past.
Yeah, like the spoon. I've heard about the spoon.
Don't do that. That can actually cause a significant amount of harm or choking. And lastly, most seizures do not require any treatment, particularly in someone with epilepsy. But if a seizure lasts more than 5 minutes, you absolutely want to call 911, or if that person has any difficulty breathing.
All right, those are good tips. Thank you very much. And folks, we would love to hear from you, so hit us up on Instagram with all of your medical questions for America's favorite doctor, Dr. Jen at ABC GMA3. All right, just ahead here on GMA3, our Ginger Z on the front.
To love and be loved by someone else, which is, you know, a feeling that belongs to everybody. So I love that anyone can participate in the retelling of this story as it moves forward.
You can listen to him all day.
I know. I was captivated. Did you hear when you said the past memories harmonizing to the present? I almost fell off my chair. You're a true artist, even just speaking. I agree with DeMarco. I just have to ask you a logistical question, kind of inside baseball, if you will.
Please.
Everyone knows the famous kissing in the rain scene.
Yeah.
But this is theater, so you're wearing denim and you get wet.
Sure do.
How do you get that off?
And all of you.
And the show. So special.
So much, man. We appreciate it.
The show is called The Notebook, the musical, and it is now open on Broadway. John Cardoza, thank you so much for being here with us. That is a really cute little
It is.
Nice
And the
package
journal,
there.
come on.
Gotta love it. And that is what you need to know on this Tuesday. I'm DeMarco Morgan.
I'm Eva Pilgrim.
And I'm Dr. Jen Ashton.
For all of us here at ABC News, make it a great one.